4 months post-hair transplant, low density. It is now 4 months after hair transplant, but density is low. 1. Can I redo hair transplant where there are more hair follicles in donor area? 2. Is there a maximum distance between hair follicles when doing hair transplant surgery? 3. Can I get natural looking hair?
Thank you for your question. You submitted several photos and you state in the substance of your question that you're 4 months after having undergone a hair transplant and you are concerned about the low density. And you're asking about the possibility of additional transplantation from the same donor area. You're asking about the proximity of hairs being transplanted together in terms of what's the maximal density achievable, and can you get a natural density after transplant? Well, I can certainly share with you my approach to patients with hair loss in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Hair transplant has been a very big part of my practice. I'm also the founder of TrichoStem Hair Regeneration Centers, and this is a system we developed that non-surgically helps patients with thinning hair, both men and women, who have been traveling from all over the world for this treatment as part of a hair loss strategy. And of course, as I will discuss later, this is a system that evolved out of hair transplant surgery. So to begin with, let's deal with some basic issues and concepts that I think would be fair to assume that your doctor probably went over with you. And that's beginning with, what is the objective of hair transplant surgery? Hair transplant surgery essentially is moving hair from the permanent donor area, which is the rim around the scalp where the hair is never lost, even with advanced hair loss, and transplanting it to areas which lack hair. Now, the challenge with hair transplant surgery is an obvious mismatch between the available grafts from the donor area and the desired coverage of the non-hair bearing area, the area that's balding. So the standard approach in transplant surgery, especially for most people who are ideal candidates, are people with frontal hair loss, is to essentially try to frame the face by placing grafts towards the front. Now, almost every hair transplant patient not only wants the front covered, but then they want the middle and the back covered. And so whenever I've done a consultation, I've essentially drawn square centimeters, little square patterns in the frontal area, and then I would show what the actual donor area looks like and estimate the number of grafts. And invariably, there's always fewer grafts than would be necessary to cover the entire scalp. Now, with modern techniques, there are ways to actually harvest body hair to add volume. Now, when you ask about the number of hairs that can be placed close together, I would generally say that even with modern, very narrow, small, thin grafts, about 20 grafts per square centimeter is about right. You see, every graft needs a perimeter of normal skin in order for it to heal without being lost. It's a graft, and basically we call it a hair graft, but it's really skin bearing hair. So it's really a skin graft, a lot of small skin grafts with hair. There's a certain amount of attrition, meaning that a certain number of hairs will not make it. A certain number of due to the harvesting process, the processing, as well as just the healing process. When we were doing a lot more hair transplants, we began using a material called ACellular matrix. This is the material that's actually derived from pig bladder that was used for wound healing to help improve the healing of the grafts as well as healing of the donor area. Well, a very good side effect turned out to be that thinning hair became thicker. From that, we developed a system called hair regeneration. And the point of this is that when we're doing these surgeries, one of the things we always had to wrestle with was also the progression of hair loss. And this is something that hair transplant surgery does absolutely nothing for. Hair transplant surgery will, for a certain period of time, provide you a certain amount of coverage, but you will still progress. Now, all of hair loss is progressive. The differences between individuals is the age of onset, the rate of progression, and the extent of hair loss. So, when somebody, particularly who is younger, starts to lose hair at a younger age and is losing a fair amount pretty quickly, you try to do everything you can to try to slow it down and stabilize it. And so in our practice, we have used hair regeneration as a strategy for people who have had hair transplant to help them stabilize and maximize the longevity of the hair growth cycles after transplant, as well as for existing hair. So what you should be also thinking about, in addition to maximizing the coverage moving forward, is how do you stabilize your progression. And when I say stabilize, it's not forever. Hair loss is still progressive. So in our practice with hair regeneration, we have essentially, for the majority of our patients who have moderate degree of hair loss with later age of onset and moderate rate of progression, we have more than 5 years of stability and improvement that we've been able to establish with this system. We have a lot of younger people who are coming, and we have been continuously improving the process and the strategies that are and customizing them for younger people who have different rates of hair loss. Very often it is recommended in this strategy to add a DHT blocker like finasteride. And unfortunately, a lot of people are afraid to take finasteride, and we discuss the risks and benefits of this drug with our patients. So I would say that it is likely that you had this discussion with your doctor, and naturally I think your doctor did their best to try to provide you with hair throughout the scalp, as is shown by your photos. A lot of times people who undergo hair transplant in this way will essentially employ strategies such as the use of a topical fiber to help cover those areas in between the grafts, to help them blend the scalp coverage so that it looks like you have more hair than you actually do. And these topical fibers come in various colors and name brands. So I think that you should, of course, you're only 4 months out, you still don't have the full growth of your grafts. Meet with your doctor. Discuss a strategy moving forward. Discuss what is likely to be the case, not just before the next hair transplant, but what kind of trajectory are you looking at. You have to always think of where you'll be a few years from now, and not just trying to deal with the short term of coverage. We have so many patients who have come to us who had transplants done in their mid to late 20s and went into their early 30s, and by the time they hit their late 30s, they barely had any coverage at all because they lost all this hair. So being proactive with maximal medical therapy, treatments such as hair regeneration, will hopefully maximize the longevity that is the potential for your hair. So I hope that was helpful. I wish you the best of luck. Thank you for your question.